So the way the story goes is in 2016, I conceived the idea, but I didn't know what to do with an idea of that small separable fastener, which is the magic to Smart Denture Conversions. So in 2018, after Ray and I had been working together for about a year, I met a patient in a chairside consult at my local periodontist's office. And in the course of just interviewing the patient, getting to know them, I found out that he had a prototyping business. And all of a sudden that consult became all about me and not about him. You have a prototyping business? You can make things? He said, absolutely. Can you make a small screw? And he said, yeah, I can make a small screw. I said, no, like a really small screw. He said, yeah, I do prototyping for the electronics industry. I can make a small screw. And I said, can you make a small screw that does this? And I described the separable fastener. And he thought about it. He said, yeah, I could do that. That sounds like a fun project. So in August of 2018, after Ray and I had been working together for about a year and had suffered through conventional conversions together, and we always dreaded those conventional conversions. You know, the idea and the premise of Smart Denture Conversions is this is as easy as doing like a chairside overdenture pickup, which was, I always delegated that to Ray. And so he was totally on board. Yeah, if we could make fixed as easy as removable, great, that's a huge win. So I began prototyping this with our prototyping engineer in August of 2018, and Ray and I began testing it clinically in September of 2018. And by December of 2018, we had pretty much worked out all of the kinks and had a final market-ready solution, which was never the intent when I started. I thought I was just making a solution for my practice to make my life better.
But since the first case.
Oh, that first case. And the prototyping process is not without its hiccups, but that first case, even with its hiccups, we thought
it was, that's when you realize it. Like,
way
oh my
easier.
goodness.
This is way better than the conventional way. And the thought came, I bet this would actually be appealing to a lot of my peers and my colleagues who are also dealing with the headache of conventional conversions for full arch fixed. So we began to get it commercial ready in December of 2018. And we had everything commercial ready by, I want to say July of 2019. But it was really difficult to get the word out because one thing that's been very frustrating to me as a clinician is how unwilling people are to share good ideas. And so it took a while for me, a private practice owner in Cary, North Carolina, to get this solution broadly known to my peers that I really believe would benefit from the simplicity of Smart Denture Conversions for full arch fixed.
That was the biggest hiccup, I think.
Yeah, the biggest challenge. So Ray and I just focused on my practice and using it in my practice, and it was amazing. But we went through several clinical workflow iterations. And I want to say, so a lot of the videos that you might see online that were posted in 2020, those are workflows that I don't use today. I still use the product, obviously, but the workflow has evolved, and it's like,
we updated to a better and a smoother.
yeah, it's awesome now.
Right.
So, and I want to say that the current iteration of the clinical workflow, how long have we had that in use now?
We still find some changes and tips, but probably about 6 months, about a year.
Probably a year.
Yeah.
So we've been using the silicone dam since about late 2020, maybe early 2021. And then we had the introduction of the silicone O-rings, which I think is a big improvement as well. And then, we still play with different pickup materials.
Right.
And we stumbled across a pickup material that I just absolutely love for its speed and its polishability and its color.
Right. And then we started learning from other clinicians that use a monolithic denture one color, and then we start finding solutions for them, how to do their workflow to work better around Smart Denture Conversion.
Yeah, so what you're saying is sometimes we go in and teach people how to do Smart Denture Conversions, which is really optimized for converting a prosthesis that has pink where pink belongs
Right.
and white where white belongs. Meaning the flange should be pink, the teeth should be white,
Right.
not a totally white denture
Right.
with maybe a little bit of pink painted onto the front.
Right.
Because when you go to cut back and contour the prosthesis, you're going to cut right through the thin layer of pink
And then
and expose the white flange.
right.
So there are all kinds of things that we teach to be totally prepared for the pickup and have a very, very smooth experience there.
Yeah. I have done conversions on in 20 minutes, but it really deviates from patients and workflow that clinicians are offering. Like, let's say when you choose to do the pickup after suturing, you have to kind of fight the tissue a little bit because it's covering a little bit arthritis. But then if you do it prior, then you got more visibility, better access. But I mean, either way, it's still, I mean, it works perfectly. It just adds a little more time when you have tissue that is in your way. So it deviates, but I would say definitely under 30 minutes. And it's not what it takes, it's the product that it looks, how it looks.
That's true.
And also how we can guide the healing of that fresh wound for a future final impression. Especially when we train the tissue to be this smooth, then the food packaging around underneath the denture is minimal. So that's a huge win thanks to a Smart Denture Conversion, because we can actually push the tissue enough without over compressing the tissue, but pushing enough where we are bringing that attached gingiva where it belongs to the bone, and then help it contain that swelling, and at the same time heal to that beautiful contour that we like to teach in Smart Denture Conversion.
That's right.
I think Smart Denture Conversion is not only that protocol that we follow, and not only that separate fastener, it's all that we teach to make every clinician, and when I say clinician, I'm talking about dental assistant, doctors, and lab technicians, work better, like work smarter, like what's gonna make their daily work with All-on-X conversions better, easier, smoother, and that's what I think Smart Denture Conversion has been for people right now. It's been tuning what conventional conversion is right now for the market. Right now, when I hear Smart Denture Conversion or just conversion, or just let's make a provisional for an All-on-X treatment, I don't have any stress. I kind of like it. I developed this, I will say, addiction to do conversions, to see new challenge from patients, because all the patients are different, like we know in dentistry. But before, when we have one of those conventional conversion, and it's not to criticize the workflow that was created for conventional conversion, because it was the one that was available actually to get around with those tall temp cylinders, etc. But now I don't stress at all.
Yeah. So I would say that I boil down the advantages of Smart Denture Conversions to just a few points. One is speed and efficiency, right? And that's actually, I mean, it's one of the most obvious benefits of Smart Denture Conversions, but I'd say it's probably one of the least significant benefits.
Right.
Because the other benefits are the strength of the prosthesis. So our fracture rates in the practice went, I mean, from probably 25% down to, I don't know, 3 to 5%. And those fractures occur simply because of a failed implant. So now I have this really big cantilever, or I leave the cantilevers on my prosthesis to the first molar because I'm trying to train the tissue. And so sometimes I will get a fractured cantilever, but it was left there intentionally. But the fracture rates have gone down significantly. The other huge benefit that people just don't talk enough about is being able to select my multi-unit abutment
Oh, yes.
more optimally for the final restoration. because I don't have to worry about a big hole being lingual to the to the aesthetic surfaces. I just have to worry about a 2.35 millimeter hole staying lingual to the incisal edge, for example.
Definitely.
So I actually use my multi-unit abutments to optimize my intaglio design. Multi-unit abutments have a huge impact on intaglio design. So for us to succeed with full arch fixed, I really just focus on three main things. One is the aesthetics, one is the occlusion, and one is the intaglio design. So if you focus on, just boil it down to those three things, then
and that you can do it in 30 minutes.
Yeah, exactly. If you can get it done really quickly and predictably, right? So that was the other thing that frustrated me about the conventional conversion was you'd see it on the schedule and you'd see it for a block of time, but you had no idea if you were going to get it done in that block of time or if it was going to become a nightmare.
The whole day. Yeah.
So, but now it's very, very predictable the amount of time it takes to do a full arch conversion.
Yeah.
And that has nothing to do with my skill level because I'm the same clinician that I was when I was doing the conventional conversions. It's just, this is an easier way to do it, more predictable, and just, I mean, it's just an easier way to do it. So, so the speed of smart denture conversions, preserving the structural integrity of the materials is a huge advantage to smart denture conversions. The intaglio design is a huge advantage to smart denture conversions.
Yeah.
And the other thing, smart denture conversions is extremely versatile. I don't care if you're like in the all digital workflow. Unfortunately, we still have implants that fail, right? So smart denture conversions has a place in the full digital workflow. When an implant fails, the easiest way to recover and do like a modification to a failed implant site is to just do a pickup with smart denture conversions in a different site and wait until that implant integrates rather than have to refabricate a whole new prosthesis. Or to do a conventional pickup and really
destroy the one that
really adversely affect the structural integrity of that prosthesis. Then the smart denture conversions also has a place in guided surgery. So rather than having a guided prosthesis that looks like Swiss cheese, you can make a guided prosthesis that just has the small wells for these low profile parts with smart denture conversions, do your pickup, and then create these very precise screw channels, and then contour the prosthesis to the ideal, not having to worry about maintaining native material beyond that big, huge 7 to 10 millimeter hole.
you can change right there your planning. So you are not stuck to a guide as well.
Yeah. Well, and then there's the application of smart denture conversions in settings with like the YOMI, the robotic surgery, or the XNAV, navigated surgery. So it's just a very, very versatile tool for anybody who's interested in full arch fixed dentistry, implant dentistry.
Dynamic planning, that's what I like to call a dynamic guide.
Yeah.
Yummy. Because you can change your implant sites right there on the spot, and still you have smart denture conversion right there for 30 minutes later to be delivered.
Yeah.
So it's not, I don't see a disadvantage for smart denture conversion.
Which is funny because, there are prominent prosthodontists out there who will make the claim that smart denture conversions has its place, but it's limited. And I'm like, I don't see its limitation. And that sounds like a biased thing to say. Obviously, I developed smart denture conversions. But I honestly cannot see a contraindication for smart denture conversions in full arch fixed applications. So, yeah, it's a very, very versatile tool.
Definitely.
So now, Ray, your role has changed with me throughout the years.
Right.
Ray used to be my chairside assistant. And then there was a large organization that needed help kind of training up their team to be able to do full arch fixed competently and proficiently. So Ray stepped away from my practice and was traveling around training a bunch of centers mostly in the South, right?
Right.
Did that for about a year,
A year and a half. So.
year and a half. So teaching smart denture conversions, teaching laboratory procedures, teaching efficient workflows to get from the provisional restoration to the final restoration. Yeah. Everything that he and I had collaborated with here in Cary Prosthodontics, he took there. But then my life was getting out of control because I have my practice that I want to maintain and treat my patients. But I was being asked to travel all over the country training people on how to use smart denture conversions. And it was just, I couldn't keep up. So I begged Ray, I begged him to come back and work for me again, this time as my vice president of training and education. So Ray actually goes around doing all the traveling and training and onboarding of people who are looking for smart denture conversions and bringing smart denture conversions into their workflow. So that's been great. I've loved having him back.
It's been a blessing for both of us, definitely.
He's an amazing teacher. A lot of the new material that will be posted will be Ray teaching the technique that he and I developed throughout the years and have, I think, pretty much perfected. We're open to improving it if we see room for improvement, but right now things are just flowing really, really well. So we welcome you and hope that all of the materials that we put together are beneficial to you in your practice of full arch fixed implant dentistry. And Ray and I are at your disposal and ready to help out and answer any questions that you may have. So thank you so much.
Thank you.